I'm Phil Corbell. I'm director of the community radio charity Radio Regen, and we're the people behind the Health FM project. You find us at All FM here in Manchester, one of the original pilot community radio stations that we helped set up but now runs under local ownership here in South Manchester. Health FM is about getting community radio stations across the country doing more health projects, whether it's putting out health messages or getting more people involved in community radio because of its therapeutic value, because it makes people feel better and has a health impact. It's a great value that community radio offers to the health sector, and this project is about opening doors and getting more stations on board with doing those sorts of projects. We're going to leave the broadcast studio now and go out into the rest of the building to find out a bit about social prescribing and quite what that means for this project. If we go out into the hall, and this is where our camera person is going to try not to trip over things, but this, All FM is based in Levenshulme Old Library. It's a recently disused library that's been taken back into community use for all sorts of purposes, including the radio station. And if you come this way, we're going to find Cormac Lawler. Cormac Lawler works both for Radio Regen, and he's done that for many years on a diversity of our projects, but now he's delving into this thing called social prescribing. Now, am I right in thinking that social prescribing is about this notion that only a small part of health and well-being is actually about taking medicine and talking to doctors and nurses?
Absolutely. It's there's a report by the Health Foundation that came out recently that said that 90% of your health is determined by the things that you do in the wider world, and only 10% of your health and well-being is actually determined by medical processes. So social prescribing takes that seriously by saying, let's look at opportunities in the community for improving health and well-being. And it's a system, basically, for GPs and other health professionals to refer people through the health system into voluntary and community activities that will help their well-being, possibly instead of or possibly alongside medication. It's not saying that medication is not the solution ever, but it's saying that there's a lot more going on that could be of benefit to you.
I've heard about social prescribing. It hits the press when a GP pays for football match tickets because it contributes to someone's well-being. Is this in the same sort of bracket?
Yeah, absolutely. And I think that the domain of social prescribing is very, very large. And we're talking about any number of activities. And it could be football, it could be, it could be sports, it could be cultural, it could be making and doing, it could be just talking with people, in terms of reducing social isolation. That's a big determinant of health. We talk about social determinants of health. So it's about finding those activities that mean something to the person and that actually will hopefully help them to maybe reconnect, possibly find some elements of themselves that they'd forgotten, or possibly find a new interest that just gets them out of themselves and just feeling healthier.
Now, both of us have been involved in community radio for a long time,
we have.
And we've seen through the projects that we've been involved in the process of sort of positive change that happens within people when they take part in community radio.
That's right.
Is that the sort of thing we're talking about now?
Absolutely. We know that community radio produces health benefits, and that's really what we're talking about today, is that community radio has this real opportunity to take advantage of social prescribing as a theme or an umbrella for what you do. I think the challenge for community radio stations is to have those conversations with the right kinds of people to tap into that funding. And it really must be said that funding is becoming available more and more in that world.
Which was my next question. So do you think it's a case of bowling up to your local GP and say, we need a bit of funding to support this volunteer at the station?
It may or may not be that simple.
You're hedging your bets there.
No, but it's a good point, because I think that GP practices do control their own budgets, and actually that sometimes the changes that you want to make could be done at a very local level, could be done by talking to your GP practice. But it could also be done at a more local strategic level. So it's about partnering with organisations that are tapped into that funding, because obviously there's also funding controlled by the CCGs, clinical commissioning groups. The funding landscape, as we know, is very complicated, but this is an opportunity for you to badge what you do in terms of health outcomes to take advantage of that innovative agenda, which is really taking over the health sector right now.
Well, that was my next point, that is social prescribing a thing yet? You're talking about it in very definite terms, but is it something that's just making its way into mainstream thinking in the health sector, or is it better established than that?
I think it's better established. I think it's zooming into the mainstream. It's really, really taking hold. Sadiq Khan has just announced that it's going to be a major part of the London health strategy. There's huge money being put into social isolation projects and various projects that use voluntary sector input. So it really is the right time to be taking advantage of it right now. It's just finding those right people to have the conversations with.
I suppose there's an aspect of being confident in the value of what we as community radio stations offer in terms of health. Do you think that there is good evidence, good grounds for going to the people we talk to in the health sector and saying, look, this works, it's as good as...
Absolutely. You don't need to do the research yourself necessarily. If you can badge and we always talk about evaluation, and the more you evaluate your work in terms of specific outcomes, and the better your chances of finding funding are. But the research has been done that arts-based activity has a huge beneficial impact on health. And so a huge part of the social prescribing agenda actually is about arts and prescription. And so that's one of the things that I think if you start to pitch yourself as a community radio station as delivering arts but also health benefits, then you're likely to be able to tap into that kind of funding.
So there is a bridge to cross in marrying the work of community radio and what other people might see as arts. There's a huge report around cultural prescribing. Absolutely. And the sorts of activities I've seen there are more like craft and dance. Absolutely. And I haven't seen much on community radio.
No, you're right. I don't think community radio has really stepped into that domain yet, but it's an opportunity. So I think it's just about finding that opportunity to badge what you're doing and pitching it at the right people.
Thanks, Cormac. Someone whose job it is to connect voluntary sector and community sector organisations into the world of health is Claire Tompkinson, and Radio Regen's Kathy Brooks has been talking to her.
Thanks very much, Phil. I'm here at Mac's offices in central Manchester with Claire and also Mike. Mike, can you tell me a bit about the work of Mac?
So Mac's the support organisation for all the voluntary community groups and social enterprises and charities in the city of Manchester. And we help them do things like find funds, be good organisations, find volunteers, and talk to things like the NHS.
Great. And Claire, you're a specialist in community groups working in the area of health, aren't you? Could you tell me it's a particularly good time for projects like that now?
I think so. A big part of my role is helping to connect voluntary sector organisations with our health and social care colleagues, and I've certainly found over the last couple of years the conversation has really changed from the NHS has all of the answers, people need to be treated by services, get a prescription from the GP and that will make them better, to much more around how do we engage with local people as active and equal partners in health and care, how do we change the conversation about what makes people healthy and keeps them well within their communities, and how can we adopt more of that asset-based approach by viewing local people and defining by their strengths and skills, especially where they have maybe a long-term health condition. That's a real strength. How do we tell their story and how do we help the NHS to learn from their experiences?
Right, well, it sounds like community stations could be really well placed to deliver that kind of work. What would the first step be if they wanted to get involved in partnership projects?
I think so, definitely. I think the community radio stations have a real key role around how community mobilises itself and tells its stories. Certainly getting some cross-sector partnerships of someone from the NHS and a local person to kind of change that narrative from passing on health messages to sharing their experiences. I suppose to me throughout the UK the best place to start would be with an organisation such as ours, which exists around the UK. I think sometimes that navigating the NHS and the health system can be really difficult, and sometimes it can take years to develop the kind of relationships and the trust that they need to take something seriously and want to work in partnership with it. If you can engage with an organisation who already has a strong track record of working with in that way and with those relationships, you've got a much better chance of getting straight to the right person with an idea.
Yeah. So you just find your local council for voluntary service or voluntary action, the name of the town. There's an organisation called NAVCA. I'm actually a trustee of it. If you go onto their website, www.navca.org, navca.org, there's actually a map of where all the equivalent bodies are, like MAC, Salford CVS, Bolton CVS. We're all over the country, so it's a great place to start and find your way around.
Great, well that seems like a simple first step. Thanks very much. Okay. Back to you, Phil, at All FM.
Thanks for that, Kathy. I'm back at All FM with the station manager, Ed Knoll. Ed, tell us a bit about All FM.
Okay, well, All FM, we're about 18 years old. We have approximately sort of 105 volunteers. These are active volunteers who are presenters and producers, and essentially we're as much a training organisation as we are a community radio station. So what that means is all our volunteers are the legacy of previous training projects. So we'll train effectively, everyone from children to older people and everyone in between, and the legacy of any training project means we offer people the opportunity to pitch for their own show, to present or produce, and become a volunteer at All FM.
And it's fair to say that the patch in South and Central Manchester, everyone's represented. I can't really think of a more varied patch of cityscape.
What we try and do is, with our volunteers and with our shows, is reflect the communities of South East and Central Manchester to whom we broadcast.
And in the 18 years, you've done a range of health projects. Could you tell me a bit about the sorts of projects you've done?
What I would say firstly is the majority of projects we do essentially have an aim beyond radio. So the idea essentially is to improve people's lives or to improve, their confidence or self-esteem.
I've seen evaluation from a mental health project that was part of the Health FM project, and the feedback from the participants has been extraordinary. The way they account for their boost in well-being, the return of their self-confidence, that sort of thing. Is that a story you can relate to?
Yeah, absolutely. I think there's a few things to think about. Firstly, what you're doing. I mean, what we do is we say to people, we trust you to go live on air. And there's no time. Well, there's no time delay. We can't edit it, but we're putting trust in you that we believe you can deliver a show. I mean, essentially, we're a professional radio station, so it's not like we want poor radio shows on. So we put trust in people. I think there's also a thing about giving someone a medium of expression. I mean, a lot of people in our communities and our society don't feel listened to. And I think there's a thing about being listened to, about having your voice heard. And I don't think you can understate the importance of that. It's about reconnecting with your fellow man and woman. I think that's a key part of it.
You've also done shows about raising awareness about conditions.
Well, yeah, I mean, we have numerous shows on All FM. For example, we have a show raising awareness about autism. And this is with people who have autism, with families of people who have autism. And the idea, quite simply, is to raise awareness of autism. And also, one of the important things a radio show can do is actually challenge misperceptions, whether that be with people with autism, people with mental health issues, disability, from, different community, et cetera, et cetera, et cetera. It can break down barriers. And also, it just presents people as essentially just like me and you.
So we've talked about things that affect people's well-being as participants, raising awareness by giving voice. Have you also done sort of straightforward publicity campaigns?
Yeah. They work in various ways. So, for example, just straight advertising. We do stuff where people come into a show and be interviewed, live reads. We want to get a positive message out there in terms of improving people's lives, improving community cohesion. I think you've got to look at the raison d'etre of community radio, and I think its DNA is intertwined with positive mental health.
Ed Knoll from All FM, thanks very much indeed. I hope you found what we've been talking about interesting. The Health FM project is all about equipping you better as a station to do health programming or programs. And whether you're a station that's already done this sort of thing or have never thought about it, please use the resources that you'll find on the Community Radio Toolkit under the Health FM banner to at least explore it a bit further and see if that's something that can really help your station and help your community.